Hey guys, it's Amy coming to you with my weeks 96 through 111, I think. I may check the description down below, but I'm pretty sure that's right. Post-op update from duodenal switch surgery that I had with Dr. Paul Enochs in Raleigh, North Carolina on June 24th of 2015, showcasing Beagle Butt. Pre-surgery, I think I was at my highest weight in the low 300s. Date of first consult, I was 275. Date of surgery, I was 265. I reached my surgeon's goal of 160 pounds and actually went a little bit below that, probably into the 150s. I'm not sure when. If you care that much, you've probably seen my videos. But I bounced back up about 10 pounds. And I've been riding high in the 160s, like 163 to 165. I weigh every week, usually once a week, and just spot check and make sure I'm not coasting up towards 170. That hasn't happened yet. So I'm 2 years and, let's see, June 24th, July, August. So 2 years, 2 months out from surgery. And wanted to give you guys an update. I've had my 2-year post-op visit with my bariatric office and my physician's assistant there, and have had my labs drawn, so I kind of wanted to let you know how everything was going. I have not had plastics. Large and in charge arms are still present. Shar-Pei legs and butt still present, and definitely still dealing with a lot of excess skin. I think I mentioned earlier 12 to 15 pounds or so of skin that the plastic surgeons have estimated would be removed when I have plastics. I'm saving for that. So I don't have the luxury of having that covered by my insurance, although I'm happy for those who do. It's not common. And I don't have the cash on hand to do it, so I'm just diligently chipping away so that I will be able to have that skin taken off, which will open up a whole bunch of things for me in terms of clothing and things like that. I mean, I'm still very much a 3/4 sleeve girl, and no skirts above the knee. Honestly, I'll be honest with you guys, I'm turning 44 in October. I'm not going to wear a ton of above the knee skirt stuff, I mean, anyway, just because of my probably more conservative upbringing. This is what I've always been comfortable in, but I sure would like to have my chest in the right place for somebody my age, and have these arms gone and things like that. So I'm looking forward to that. I don't mind the scars one bit. I will be completely fine with that, just to have, to be the size that I really am. Right now, just to give you guys an idea, I wear a size 8 in pants and a medium to large top, depending on how they're cut and who makes it. And I'm totally fine with that. I really don't have any strong opinion about needing to be a certain size or anything like that. I think it's because I was, and as many of you guys probably too, I was overweight for so many years that I'm ecstatic to not be size 20, size 22, size 24. This is all gravy for me. It truly, truly is. The plastics are for vanity, absolutely. I don't have any reason that I have to have them, but I think they will boost my confidence, and I think they're a calculated risk after I've had the consults I've had, both out in California and here in the North Carolina area. No licking. Sorry, we're working on some licking issues with his paws and stuff. Anyway, sorry about that. Let's see. So updates. So my current weight is, like I said, about the other day was 164. That's fine. I don't have any complaints really. The outcome of all of the work I put in during the weight loss phase has been great. And this surgery, specifically the duodenal switch, frankly, is a really powerful tool. It doesn't prevent regain at all, but the level of malabsorption exceeds what you get with a sleeve, obviously, where there's none, and with a standard gastric bypass. And as a result of that, while you have to be careful with your supplementation and vitamins, and while you have to be careful with your carb intake and other things like that, you get an easier time of it, I think, with maintenance. That's what I'm seeing from other people who've had duodenal switch. Nobody gets off scot-free. You still got to work for it, but you get a boost. It's a strong tool. And that's what's been happening to me so far. I'm a little over 2 years out. That's not, I'm past the honeymoon pretty clearly, but I'm still, I haven't seen any real attempts on the part of my body to put regain into play. I haven't had to work that hard to make this happen and stay where I'm staying. There are a few features and factors for me that may play into that, and I don't know to what degree they do, so I'm not going to pretend to take credit for anything when I don't really know what's causing this metabolic shift. But I do know, or the maintenance of this metabolic rate. I do know that I work out pretty regularly. I'm an active person. I love seeing what this body can do. And I'm not some superstar athlete, but I love Pilates, and I really love doing yoga and stretching, and I really love walking and hiking, and I do some swimming too from time to time. So, I don't have very many days where I'm not making, 10 to 12,000 steps minimum, and those are on days even when I don't work out. So I'm moving. I think that helps. The other factor that is helping me so far is, I think, eating all the time. My engine stays revved up because I'm moving and doing stuff. And I'm eating every couple of hours, small meals. I'm having an easier time of it, I think, than I would if I ate in slower, more condensed pockets. I have that luxury. I have that luxury of time to be able to do that, and I'm not going to pretend that it's not a luxury. I don't have the same compressed schedule that a lot of folks deal with. I don't have kids, things like that. So that really helps me succeed in that sense. Although it's certainly possible to succeed without a lot of spare time. I've seen amazing results in other people's videos, and I'm excited for them. So that's basically what's going on with me. I had my labs drawn, as everyone should who has a malabsorptive procedure. They tested for all of my vitamins. They tested hormones, metabolic panel, blood, standard, red blood cells, all that good stuff. Protein, iron, you name it. I am in good shape. I was a little low on one type of vitamin K, and I boosted that. And as I said in previous videos, that's why I don't take an ADEK vitamins standardized, because I need to titrate those and change those vitamin doses rather individually. So this allows me the flexibility to do that, but it makes me take a lot of pills, little capsules every day. And I don't really mind. It's not a big deal. I give myself a treat when I do that. So I'm like, it's vitamin time. Oh, I'll get, a little bite of something that I like. So labs are good. They did a swallow test. They checked the size of my sleeve. They said it hasn't stretched. Sorry for the beagle snoring. They said my sleeve has not stretched and I'm in good shape. Absorption so far seems to be good. My protein levels are good. And I'm still taking in 80 to 90 ounces of water every day, and one coffee in the morning with quite a bit of heavy cream in it. That's my liquid intake for the most part. I have a sip of soda like once a month, but I've kind of lost my taste for it, just because I can taste the chemicals now because I've been away from it for so long. So, but I am not perfect. Let me take a few minutes aside here to express to you how strongly I feel about this issue. The Dorito monster gets me the same as it gets everybody else. There are snacks and things that I engage in that I end up in the restroom because of the level of malabsorption that I have. Carbs are made for work, heavy work, labor, physical activity. If you are not going to engage in those activities, as a person, you should not be taking in tons of carbs. Can you? Sure. But your body's going to be like, where the hell am I supposed to put this? It is not something that is easy for you to use. And that's why low carb diets are so effective. It's not that carbs are evil. And when I do eat them, I absolutely eat, veggies, and I have fruit, and there are days when I over imbibe. But for the most part, I'm a fruits and veggies girl with occasional succumbing to the Dorito monster. I don't eat low carb. I find that my system tolerates pretty well, like yogurt for breakfast, an open-faced sandwich, so one slice of bread with lots of protein for lunch, and then something pretty low carbish for dinner. So, but I'll have a few Doritos, or I'll have a couple bites of mashed potatoes, or sometimes, there's a dessert that can't be denied, and I'll have a couple bites of that. But I found that the secret to my personal success is not to tell myself I can't have it, because then that's all I think about, because I love food. That hasn't gone anywhere. I definitely, though, will be careful about it. Allow myself to have 3 or 4 bites, and then that's it. I walk away, and if I walk away, I get off almost basically scot-free. I don't have digestive issues and discomfort and gas and bloating and all those things. If I overdo, there's a price to be paid, and that's what comes with this surgery. It's a responsibility. If I were a heavy binge eater, or had other issues like that, which some of my surgical friends do have that issue, and eating disorders and so forth, I think this surgery could potentially be really limiting and painful and uncomfortable. So choose carefully when you're picking your surgery, if you're in the pre stages, and know yourself and choose something that's going to work well for you. I love my DS. I love everything about what it has given me, and allowed me to do and allowed me to be, and kind of unveiled the tomboy that I largely am in terms of the things I like to do. But I respect it. As not strictly, but I do respect its power. It can land me in the hospital, or worse. Those vitamins get taken, get ordered, get handled. And I go in for my labs, and I monitor what I'm doing. And I would encourage you guys to do the same. That's it for me. If you guys have any questions, this is me at 2 years out. I'm feeling great and doing fine, and am excited to check in with you guys and watch some of your videos. I've stepped away from YouTube, and I want to get back to it. I say that every single time. It's just hard not to, when you're post-op, find yourself rekindling different parts of your life that you had to file away. Because of weight and health issues. In my case, severe diabetes and back pain and all sorts of problems. And that has largely changed for me. And so I'm eager to not waste a single minute of it. And not that time on YouTube is wasted, because it sure as shit is not. It absolutely was transformative for me. It is supportive for me. And I sure appreciate you guys offering that support, both to me and to each other. I'm here to pay it forward for sure. Thanks, you guys. I will keep sending updates from time to time, and I hope that this finds you all well and happy. If you have any questions about surgery or my surgery or anything I can help with the research that I've done, I'm happy to pass it along. No doctor, but I'm happy to pass along what I know. Please take care of yourselves and be well. Okay? Thanks. Bye.